Good morning, everyone. I wholeheartedly welcome you all in my speech. This is day two of a 39th International Conference on Ayurveda and Pain Management. And on day one, we have heard so many wonderful lectures of various speakers all over the globe. And I wholeheartedly thank Team Apna that they are organizing a wonderful conferences, wonderful seminars for giving opportunities to Ayurveda physicians and young doctors and even for the community. It will be beneficial for community too. So a very burning topic in which today I will be going to speak on this 39th international conference organized by APNA and myself, Dr. Krup Pasauda. I am working as an associate professor in the Department of Toxicology and Forensic Medicine in JS Ayurvedic College, Nadiad. And I have done my specialization, my master degree in pharmacology at SDM College of Ayurveda Hassan. And I'm having very much interest in joint disorders, to treat joint disorders. And pain management is again a very interesting topic of mine. And today I'm going to present a very unique topic, and to convey in easy way, let me share the screen. So, pain management of sciatica through Ayurveda, and it is a treatment approach, a clinical treatment approach, what I have taken here. So today I will be going to deal with the contents like a background and objective of the study and materials and methods, its results, discussion, future research avenue, and conclusion. So when we see the introduction of pain, it is a very serious problem globally due to its high prevalence, as we all know, and regarded as the fifth vital sign. It is an unfavorable sensation too, and physician will get so many patients in suffering from pain in their daily OPDs, in their daily routines. Pain may vary, like pain may be a throbbing pain, a toothache, eye ache, and colic pain, and etc. There are so many different ways from which pain exhibits. Pain is also a protective mechanism of the body to respond to a harmful stimulus. And if we see definition of chronic pain, it is considered as a health crisis due to its high prevalence and associated physical and emotional incapacity. So, if we see Ayurveda text, Ayurveda classics, of what Ayurveda says about pain, the term Shula or Ruja is used for pain, and it is a cardinal symptom attribute to vatadosha. Vata disorders arise out of two main mechanism or two main pathologies. What we say, first is occlusion or obstruction of vata, to which we can say avaranajanya roga, or due to depletion of the body tissues like dhatus. And pain can be appear as a roga. Prior to roga, we can say prodromal symptoms, or a complication, we can say it as a upadrava. So if we balance vata dosha, there will be a direct treatment of pain. We can rather say in Ayurveda that if we combat vata dosha, then directly there will be a relief of pain. So now let us move on to our disease. What is sciatica? Sciatica is a debilitating condition in which the patient experiences pain and or paresthesis in the distribution of the sciatic nerve or an associated lumbosacral nerve roots. There are so many reasons that there will be a nerve compression, like sometimes there may be an injury, sometimes herniation of disc, sometimes there may be disc bulge. There are so many reasons. And lumbosacral nerve root, lumbosacral spine is playing an important role to occur a condition like sciatica, and it affects many people. The most important symptoms are radiating leg pain and related disabilities. So once again, the pain is a main symptoms on which we have conducted this wonderful conference. So it is a main symptom of sciatica, and that's why I have chosen the disease sciatica to be dealt here. If we see the prevalence of sciatica, it varies considerably, ranging from 3.8 percentage in working population to 79 percentage in non-working population. So it is more in non-working population, and it is most prevalent in the people during 40s and 50s, and men are most commonly affected than women. If we see the annual prevalence of disc related sciatica, as I have told previously, like herniation of disc, degeneration of disc, bulging in disc, if we see the disc related sciatica prevalence, then in general population it is estimated as 2.2 percentage. Now we have seen what is pain in Ayurveda. As in previous slides, I have dealt with sciatica. In Ayurveda, sciatica is considered as Gradhrasi, and it is considered among the minor diseases which are occur from vata dosa. So it is vataja nanatmaja vyadhi, and also presents with a clear picture of shifting pain in lower limbs. As I told, from back to buttocks and whole posterior leg will involve in Gradhrasi. So if we see the cardinal symptoms of sciatica, moderate to severe pain in lower back, buttocks, and down to leg, and numbness or weakness in a lower back, buttocks, leg or feet, pain that worsens with movement, loss of movement sometimes, and pins and needles feeling in your legs, toes, or feet. And sometimes, not in all the patients, but sometimes we can find loss of bowel and bladder control. So now let us move on to the objective of today's study. So as we are studying, as we are conducting a clinical study of sciatica, here we are evaluating an efficacy of multimodal treatment protocol in the management of sciatica. Rather, in Ayurveda, we can say Gradhrasi. So let us check the materials and methods what we have performed during the studies. So the sampling method of patients were random sampling method, and sample size was 30 patients what I have taken. Data collection through interview method, and after that following diagnostic criteria like patient having pain, stiffness, numbness, walking inability, and with straight leg positive. So if we see criteria for selection of patient, the inclusion criteria, what I have selected in my study, having classical symptoms of Gradhrasi, namely pain over waist, back, thigh, hip, knee, calf region, and extending up to foot, having stiffness, pricking pain, tingling and numbness of limbs, and difficulty in walking. And patients with SLR test positive, as we see a picture downwards that more than 70-degree SLR is negative, and if we find a pain while raising our legs, if we find difficulty below 70-degree by raising our legs, we should diagnose the case as any deformity in back region, and one of it, if it is related to a spinal cord, if it is related to nerve root compression, we can say it as a sciatica. So the age group of which I have included is 30 to 60. And exclusion criteria, many chronic diseases I did not took, like case of spondylolithiasis, sarcoiliac arthritis, and known case of tuberculoma or cyst compressing the nerve root, diabetic neuropathies also excluded. Patients having multiple wounds and fracture of vertebra and destructed vertebral bodies were also excluded. So, how I have assessed my patients? According to their symptoms, I have given gradings like 0, 1, 2, and 3. And then I have analyzed the patient's condition on certain follow-ups like different symptoms like pain, numbness, walking distance, tingling sensation, and SLR test. So I have mentioned a multi-modal treatment protocol. So this protocol involves massage therapy, abhyanga with Nirgundi Taila, oil of Vitex negundo, fermentation or shudasan like Svedana, Nirgundi Patra Sveda with leaves of Vitex negundo, Then Basti treatment, enema with Dashmuladi Niruha Basti, uh, and Sahacharadi Taila Anuvasana Basti. Basti I have given of two different drugs. Dashmuladi Kwath Basti I have given, and Sahacharadi Taila Anuvasan Basti I have given. Some treatment, samana remedies, some medicines I have prescribed to the patient was Nirgundi Gandvati and Parijat Patra Gandvati. And some of the home remedies, which is very important, they play very important role to combat a pain or release obstructs vata dosha. Fenugreek, in Ayurveda we can say methika, or ajwain we can say ajmo, ajmod. So this treatment protocol I have followed. If we see Dashamula, content of Dashamula, I have shown pictures like Selpan, Indian Uraria, then India nightshade, then yellow berried nightshade, and then land caltrops, and then Bengal quince, and then white teak. 10 roots of 10 different medicines. We can say it as a Dashamula. So, the schedule of Yog Basti, what I have planned, here I have written A, which is Anuvashana Basti, which is a Basti of oil, Sahacharadi oil, and N is Niruha Basti, which is of Dashamuladi Kvatha. So the schedule what I have followed on 8 days of treatment, Anuvasana, then Niruha, then again Anuvasana, then Niruha, then on 5th day Anuvasana, then 6th day Niruha, 7 and 8 day it was Anuvasana. So if we see observations and results, my study includes 63% of male patients and 37% of female patients. As in previous slides, as we have seen that it is more prevalent in male than female, and the age of patient also is distributed here. Limb affected in sciatica, 17 patients were of left limb and 13 patients were of right limb. If we see effect of therapy, almost all the p values, almost all the values which I have got was significantly improved. And mean difference, if I say, in pain it is 0.11, in numbness it is 0.45, walking distance is 0.09, tingling sensation 0.50, and SLR 2.7. So this data is extracted from SPSS software, and almost all the signs and symptoms are significantly improved and having good results of the therapy. Now, if we see the discussion, Basti Dravya when enters into colon, in Ayurveda, it can be said as Pakvashaya also. It is the place where water and minerals are absorbed. It helps to increase the capacity of absorbing. And behind the colon, there are 3 large numbers of nerve plexus originating from the hypogastric plexus and lumbosacral plexus. And this plexus will get nourishment and soothing effect. Here there is the role of Basti Karma. It mainly acts on the Pakvasaya, as I have told, in colon, and nourishes, purifies, and expel out unwanted toxins or dosha, what we say in Ayurveda, vitiated dosa from the body, it expels out vata dosha mainly in this type of condition from body. Dasamula is having a well-known anti-inflammatory and analgesic effect. It is used for inflammation and for its calming effect on the mind and nervous system. Sahacharadi Taila, which is used for Anuvashana Basti, containing drugs, among them all are having hot potency. Ushnavirya, what we can say in Ayurveda, and they all are having Kaphavata Shamaka properties. It is indicated in difficulty in lower limb causing the altered gaits. If we see Ayurveda classics mentions Basti as a Ardha Chikitsa in Vatic disorders. So again, here there is a vitiation of Vata, and if we give Basti, then nerves will get nourishment and there will be an expulsion of dosha, of vitiated dosha like vata and kapha, and we will get a relief in pain as pain is generated by vata dosha. If we see mode of action of Nirgundi, there we have given a Nirgundi Ghanvati, means a decoction of Nirgundi. If we boil it, from there we can get a hard material that is called as Nirgundi Ghanvati, and it is again directly acted on Vata and Kapha because of its bitter and pungent taste and its hot potency. Ayurveda always mentions a basic principle like Sarvada Sarvabhavna Samanyam Vruddhi Karakam Rasa Hetu Visesascha. When there will be two things which are incompatible to each other, there will be a loss of both. So here, Vata is having cold potency, is having cold in nature. So if we give a dravya of hot potency, there will be a demolition of Vata. And fresh leaves of Vitex nigundo have anti-inflammatory and pain suppressive activities, probably mediated via inhibition of prostaglandin synthesis. So we are giving Svedana from Vitex negundo leaves. So they possess anti-inflammatory and pain suppressing activities because there will be an inhibition of prostaglandin synthesis. Now, if we see Parijat Gandvati, Parijat Patra specifies Kapha dosha because of its hot potency and its bitter taste. It is very useful to combat disease conditions related to Vata and Kapha. So, on the basis of its pharmacological properties, it can be concluded that it possesses Kapha Vata Hara action. Now, if we see our two very good, very effective home remedies, one, this both we can get from our kitchen also. So one is Tachyspumum amni, to which we call as Ajmoda, and it is very effective against perifical pain of both neurogenic and anti-inflammatory origin. This may result from included inhibition of mediators for inflammation such as cytokines, bradykinins, serotonins, prostaglandins or histamines, possibly via phenolic and steroidal phytoconstituents present in the extract. So if we take alcoholic extract of Trachispermum emni, it possesses anti-inflammatory as well as analgesic or pain relief effect. So if we see Methica, Trigonella, the chronic analgesic effect of the fenugreek extract was observed, and studies have shown that fenugreek seeds reduces the pain through serotogenic system. It extract contains alkaloids which are having analgesic effects. So if we see future research avenues in large scale or large sample size, this treatment protocol can be given for the other arthritic conditions or other inflammatory condition, as our whole protocol poses vata and kaphahara treatment. And as I told previously that vata is main cause for pain. So we can do more studies on other arthritic and inflammatory condition. So to be conclude, Ayurveda is a science consists of pain management treatment protocols, which is very effective in cases of musculoskeletal disorders. Classical Panchkarma procedures and medicines prove to be easy, safe, non-complicated and economical way to reduce the pain in sciatica. There was no untoward effects found during a course of this clinical study, and hence this multimodal treatment protocol can be prescribed as an official consultation by Ayurveda physician, considering its effectiveness and safe therapeutic regimen. So at last, I acknowledge whole team of Apna for giving me this wonderful opportunity, especially Professor Vaidya Dr. Sekhar Annambutla sir. I am heartily thankful to you, as sir is doing so many activities related to Ayurveda, and he gave so many opportunities to so many young doctors to flourish their knowledge on social media, on via online conferences. So I highly acknowledge you, sir. Thank you very much for giving a wonderful opportunity. I acknowledge Dr. S.N. Gupta, sir, Director International Activities. I acknowledge Dr. Pradeep Vaishnav, sir, the Director PG Studies, and Dr. Kalapi Patel, sir, Principal and Medical Superintendent, JS Ayurveda College, Nadiad, to give moral support and to encourage. And I acknowledge my sincere patients who make this study successful. And I also acknowledge my all colleagues. So thank you all. It was a very good session. As we see that pain management is a very burning topic, we must treat conditions like sciatica or like frozen shoulder or like any musculoskeletal disorders we find. Thank you everyone.